Traumatic intracranial hypertension. Traumatic brain injury. Traumatic brain injury, also known as intracranial injury, occurs when external force traumatically injures the brain. TBI can be classified based on severity and mechanisms on other features.
What is intracranial pressure? Intracranial pressure is pressure inside the skull, which can damage the delicate brain tissues. Hi, I'm attorney Robert Jarchi, and today's topic is intracranial pressure and monitoring. When the brain is injured by trauma, much like any other part of the body, the injured tissue may swell, and fluid may collect and build up in that area. But because the brain is unique in that it's encased inside a bony skull, the swelling brain has no place to go, which creates pressure inside the skull. Now this can damage tissue, but it's also serious because the pressure inside the brain may actually restrict blood flow to the brain.
Elevation of intracranial pressure can reduce cerebral perfusion and cause or accelerate ischemia. The normal ICP is a resting state approximately 10 mm of mercury. Pressures greater than 20 mm of mercury, particularly if sustained and refractory to treatment, or associated with poor outcomes.
Taking me out again. Taking me out again. Sit on the porch when day breaks. We want extra butter cornflakes. You're taking me out again. You're taking me out again. You say you don't belong here.
States that the total volume of intracranial content must remain constant because the cranium is a rigid, non-responsive container. Venous blood, cerebrospinal fluid, can compress out the container, preventing a degree of pressure buffering.
Waiting for the next day to come, so I can shout out to everyone how you never did sleep. You've always been living here. It's not over till it's over. It's not over till it's over. And it's over when I say it is. I can feel your kiss.
ICP monitoring, intraventricular catheter, subdural screw, and epidural sensor.
Monitoring. Doctors may insert a probe through a hole drilled into the skull connected to a monitor that allows doctors to measure a person's intracranial pressure. Range. Intracranial pressure can fluctuate during certain activities, but normal adult intracranial pressure ranges from 5 to 15 millimeters of mercury. If you or a loved one has suffered a brain injury and you have any legal questions about your particular matter, I want to encourage you to pick up the phone and give me a call. I answer legal questions every single day, and I welcome your call. You can reach me.
Symptoms: headache, nausea, vomiting, red vision, pupil edema, degrees of sensory engagement.
Signs and symptoms. All suspected brain injuries should be immediately evaluated by a qualified physician. Signs and symptoms of intracranial pressure include the following: vision impairment, headache, lethargy, weakness, nausea, seizures.
Treatment: intubation and ventilation for airway protection, barbiturates, hypertonic saline, mannitol, anticonvulsant, or through intracranial hematoma that can be degraded surgically.